In this lecture, I'm going to go over the homework assignment. First, we'll look at the textbook assignment, the chapter review that's on page 429. And you're answering the odd numbered questions 1 through 19. For question number 1, there is one code. For question number 3, this question has 2 codes, and this patient is a high risk for lung disease due to on-the-job exposure to asbestos, and patient has a 20-pack year history of smoking cigarettes. The principal diagnosis code for this question is a Z code, and it's related to this exposure to asbestos. And then, of course, you're going to code the fact that this patient uses nicotine, smoker, 20 packs, so they smoke cigarettes. Number 5 has 2 codes. So this patient has a left tonsillar abscess, and the abscess was drained, so you have 1 diagnosis code and 1 procedure code. In number 7, this patient has Haemophilus influenza pneumonia, and the patient is also being treated for influenza. So Haemophilus influenza pneumoniae, and they're also being treated for influenza. So this is 2 codes. Number 9, status asthmaticus in a patient with severe persistent asthma. This is 1 code. So this is 1 code that would include the severe persistent asthma with status asthmaticus. Now, number 11. This is acute on chronic respiratory failure due to sarcoidosis involving the lungs, and endotracheal intubation and mechanical ventilation for 3 days. So a day is 24 hours, so you need to convert the 3 days to the number of hours to come up with the correct mechanical ventilation code. You're also putting in an endotracheal tube, so this is an insertion of device in trachea. We've looked at both of these codes. And this particular question has 4 codes, 2 diagnosis codes, and the 2 procedure codes. In this example, the patient has the sarcoidosis, and that's going to, in sequencing, that is going to be your principal diagnosis code. Number 13 has 1 code. This patient tested positive for H1N1 influenza. Number 15 has 2 codes, acute and chronic sinusitis. Number 17 has 1 code. Number 19, this is a patient who has empyema with insertion of left chest tube. Empyema was due to Staph aureus. So in this instance, we have the code for the empyema, and then we have the code for the Staph aureus. Now, in the previous lecture, I said I was going to show you these codes. We've looked at them before, and these are the codes that are bacterias and diseases classified elsewhere. And if we look at this, we can see that these codes B95, 96, and 97 are codes for organisms that are causing diseases. Now, for instance, if I look up Staphylococcus, you can see that there's a specific subentry as cause of disease classified elsewhere. And so that is the code that I would choose for an example like this one. And then we also have the procedure code, which is the insertion of the left chest tube. And if you remember how we coded the thoracentesis, that is a comparable table to that. It's an OW. Okay, so now let's talk about the workbook assignment. And for the workbook, you're doing glossary definitions, and then you're also completing case scenarios. And so case scenarios are just kind of mini HMPs or discharge summaries that you can use to code from. Now you're going to be coding number 1. And in this case, the patient is 67 years old, came to the ER with shortness of breath. She was in her usual state of health until a week ago, when she began to have chills, fever, and a cough. No, she did not have COVID. Patient was admitted and started on IV antibiotics for pneumonia. Her COPD exacerbation was treated with albuterol and oxygen. Her sputum grew grew Klebsiella pneumoniae. And then Coumadin was continued for her chronic atrial fib. So the final diagnosis is pneumonia due to Klebsiella, COPD with acute decompensation, and then the atrial fib. Now, when we code this, I'm going to instruct you to sequence the pneumonia as the principal diagnosis. In reality, based on this documentation, either the COPD or the pneumonia could be principal, but I want you to go ahead and sequence the pneumonia as the principal diagnosis. Now, for this, there are 5 diagnosis codes. One of them is a Z code. And so remember, when you're looking at this, that we can see that she is on long-term Coumadin. Okay? Now, let's look at number 3. This patient's admitted with shortness of breath and fever that's been present for 2 to 3 weeks and has gotten progressively worse. The patient has a history of rheumatoid arthritis. A CT scan showed evidence of bronchiolitis obliterans, organizing pneumonia, BOOP, B-O-O-P. The patient was started on prednisone and discharged when her symptoms had resolved. And so the final diagnosis here is BOOP and rheumatoid arthritis. And there are 2 codes. And then you're also completing 9. So in number 9, the patient's admitted for treatment of pneumonia. She's had a cough and a fever for the past 3 days. She is being treated for metastasis to the lung. She has a history of breast cancer. She has a mild COPD with emphysema, and she's being treated with IV antibiotics and fluids. So this final diagnosis is fever due to pneumonia, metastatic breast CA, and emphysema. Now, we know very well that fever is not going to be a principal diagnosis here. She was admitted for pneumonia. That pneumonia meets the definition of the principal diagnosis. She also has metastasis from her breast cancer to her lung. She has a history of breast cancer. It does not tell us here that she's had a mastectomy. We also know that she has COPD with emphysema. Make sure that you review the information in your book about how you're going to code this. And then she was treated with antibiotics. So for this particular, for number 9, there are 4 codes, and one of them is a Z code. If you have any questions about any of these, please be sure to contact your instructor, and that will conclude this final lecture for Chapter 17.